I'm Tony Van Ho. I'm a medical oncologist at Compass Oncology. I would like to begin my talk with a quote from Margaret Atwood, who is a well-known poet and novelist. I would like to be the air that inhabits you, for a moment only. I would like to be that unnoticed and that necessary. That saying could be about love, it could be about loss, or even death. But for today's purpose, it could be literally about air and lungs, or about lung cancer. It's a sad saying, so by the end of the talk, I would like to change it to something more inspirational. During my training in medical oncology from 1999 to 2002, along with my mentors, I saw many patients with lung cancer. Most had advanced disease. At that time, we did not have the knowledge about lung cancer as we do now, and therefore, treatments were very limited. For patients with metastatic disease, they were offered either empiric chemotherapy if they could tolerate the side effects, or hospice care if they were too frail. I remember one patient in particular. He was a young American. He was an investor who traveled to Germany frequently. He was a newly married man to his German wife. Shortly after he got married, he was diagnosed with lung cancer, stage 4. He was given chemotherapy, but unfortunately, his disease progressed despite the fact. I remember the expressions of sadness and fear on their faces. His wife, she had a small pin on her collar. She called it Klarstreife, meaning clear ribbon. At that time, a clear ribbon was symbolic for hope and support for lung cancer. It was colorless, or more so, it did not deserve a color because lung cancer patients felt the association of shame because of the smoking. Many lung cancer patients were living in secrets with their diagnosis and their treatment. Despite the stigma that all lung cancer patients are smokers, about 20% of patients have never smoked. In addition, about 60% of patients had quit smoking prior to their diagnosis. Some had quit smoking many years prior to the diagnosis. Times have changed much for a cancer that brings more than 220,000 new cases each year in the United States. A cancer that takes about 160,000 lives each year. The landscape for lung cancer screening, diagnostics, and therapy has changed dramatically since 20 years ago. In the past, lung cancer was managed as a single disease entity where treatment was very limited. But today, our understanding and recognition of lung cancer as a disease of many genetically and clinically distinct subtypes allows us to treat patients with more precision. I believe such remarkable change has to do with public awareness and funding for research. I'm here today to raise that awareness. Most of us know about breast cancer awareness with all the pink ribbons around us, the fundraising programs, the patient support organizations, and the screening mammogram for example. Until now, there is still much support for the breast cancer community, which is amazing. As for lung cancer, increasing awareness has led patients to take a more active role in the community. With the support from their families and from the medical teams, they are coming out, they are speaking up, they are telling their individual stories in the hopes that they will make a difference in finding better treatment for cancer or even a cure. Many patients participate in research studies. While chemotherapy remains the mainstay of therapy for some lung cancer patients, research studies have led to added options of targeted therapy or immunotherapy for other patients. These are drug treatments that alter the genetic mutations or the immune environment of cancer cells. Lung cancer awareness is about prevention and decreasing the risk of lung cancer. Because smoking is a cause of lung cancer, some states have passed a law to increase the age of tobacco purchase from 18 to 21. Oregon became the 5th state to adopt that law, and it went into effect as of January 1st of this year. Lung cancer awareness educates and urges individuals who are at high risk for lung cancer to be screened for the disease with a CT scan. 2 years ago, the American Society of Clinical Oncology posted that in the United States, there are about 7 million to 8.5 million people who are considered high risk for lung cancer. However, that same year, only 1.9% of the patients were screened. In literature, there is an award-winning autobiography called When Breath Becomes Air, written by Dr. Paul Kalanithi. Dr. Kalanithi was a neurosurgeon at Stanford University. He was diagnosed with metastatic lung cancer at age 36, and he died at age 37 3 years ago. This beautiful book tells his diagnosis, treatment, and times with career and family. At Compass Oncology, we want to create awareness to move the needle on the issues that we care about the most. If you think you are at high risk for lung cancer, ask us about lung cancer screening. If you are a newly diagnosed lung cancer patient, ask us about diagnostic and treatment algorithms. If you want to expand your treatment options considering research trials, ask us about clinical trials. If you want to reach out and connect with others who have lung cancer, ask us about a support group that is open to the general public. And if you want to engage in awareness for lung cancer, walk with us in a variety of organizations that support lung cancer patients. To end my talk, and no offense to the wonderful Margaret Atwood, I will say, we would like to be the air that inhabits you. We would like to be noticed and to be necessary. We would want to make a difference. Thank you. For more information, visit us at compassoncology.com.